Well, hi there, Year 9. Now, this is a part 2 of keeping up with lockdown. And what this part of the video is going to do is it's going to talk to you about modern medicine. So I'm going to overview each part of the modern medicine course. So today, this video is going to go through DNA, lifestyle choices and how we diagnose people, treatment through magic bullets and penicillin, the development of the NHS in 1948, treatment through surgery and how that developed, prevention of illness, including vaccines and change for life, and then the case study on lung cancer. And then we're going to finish the video looking at how much progress there truly was over a period of time during this and what we've still got to work on throughout the modern period. So the first topic for today's video in keeping up with lockdown is DNA and the cause of disease. Now, if you were to get a question on why the cause of disease changed, we know about germs at this stage. So we've got to understand that genetics and DNA developed over time, and there were significant reasons for this. So early work on genetics, by 1900, it was clear that germs did not cause all disease, and some conditions were born, and some conditions people were born with, and they didn't really know why. Now, there were early theories on genetics. So there was the theory that genes are inherited from each parent, which was known as the fundamental laws of inheritance. But it wasn't until the development of the electron microscope that could zoom in 10 million times that genes could be seen clearly. Even by 1950, there were still sort of missing pieces of the puzzle, DNA, that hadn't been found. Okay. And it actually took a load of different discoveries to find DNA. It started in the late 1800s when scientists knew DNA existed and controlled what we are like, but they couldn't really prove it scientifically. And it was only with the developments in science and technology of the 1900s that allowed scientists to first photo human cells and then work out that every cell in the human body contained DNA, codes that control the genes of the people. Okay? So in 1953, Watson and Crick discovered the structure of the DNA. They also proved DNA was in every human cell and was passed down from parents to children through their genes. And they understood this concept of the double helix. All right. Now, before Watson and Crick, you had Franklin and Wilkins who created the X-ray of sort of DNA. So what Franklin did was they worked with Watson and Crick to develop a technique to photograph DNA, which created the model, which some of you might have seen in your science classrooms, but you can also see here the model of the DNA structure. Why is it important? Well, it allows us to identify hereditary conditions. It also allows us to potentially try to prevent illness before someone's born. However, even though we know about DNA, there are still some issues, which we'll talk about shortly. Following the findings of DNA, scientists then wanted to try and unpick it further. And one way they tried to do that was through the Human Genome Project. And this was in 1986. It began to identify the purpose of each gene in the human body, completing a complete map in 2001. Mapping the DNA allows us further to understand the cause of genetic illness. And that's really important. Okay. Now, scientists could use the blueprint of human DNA to look for mistakes or mismatches in the DNA of people suffering from hereditary conditions. And if they identify the mistake or the mismatch in their DNA, they might be able to identify the gene which might lead to a further treatment later on. Okay, so scientists have now, for example, been able to identify a gene that's sometimes present in women who suffer from breast cancer, which can lead to the woman choosing to have a mastectomy, which is removing their breast to prevent them from having breast cancer when they're a little bit older. Okay, now the DNA and the cause of disease. Once the germ theory helped doctors and scientists because of identify bacterial causes. DNA helps us identify genetic causes of the disease that have been inherited from their parents. It also lets them work out how to help sufferers and prevent the disease. And there's that hope that genomes could be added to lead to treatment. So potentially that you could add genomes on the genetic pathway, which would lead to a treatment. And the impact of this is that doctors can identify specific genetic disorders, such as Down syndrome, Parkinson's disease, diabetes, cystic fibrosis, and Alzheimer's disease. Okay. So finally, what is the importance of the DNA discovery? So future medicines, DNA discovery and its impact on medicine is still ongoing. We don't know where it will take us in 5 years. It might be the most important breakthrough of all time. It might lead to help with cancer treatment, cancer prevention, who knows? You can treat using gene therapy, and it can help sufferers from diseases like sickle cell anemia, but there's still no effective cure or treatment for genetic conditions for things like Down syndrome or cancer. And prevention. Doctors can now screen for genetic diseases or those with hereditary traits such as breast cancer. They can be offered a mastectomy to remove the tissue to prevent cancer. And also parents can be offered abortions for embryos which highlight early signs of Down syndrome. But again, that's a very ethically, it's a debate in itself. But doctors, it's not the sort of right way that doctors want to go by offering abortions for embryos where they have signs of genetic illness. But the DNA structure, the DNA development was a real big turning point in sort of the future of medicine, and it allowed to identify genetic conditions rather than just bacterial issues. The second thing we're going to look at is lifestyle choices and how we diagnose patients, which is a really easy concept in this part of the course. So with lifestyle and cause of disease, now it's really, really simple, okay? Because we have a better understanding of what makes people sick, we understand that lifestyle factors play a significant role in the potential illness for a person. So we've got stress, smoking, drinking alcohol, lack of exercise, being overweight, poor diet, even poverty. And I'm going to go through just a couple here. So smoking, we know this from the lung cancer side of the course, but doctors have linked smoking to a variety of conditions, mostly lung cancer. They also recognize that smoking is associated with high blood pressure, heart disease, throat or mouth cancer, and gum disease or tooth decay. Even secondhand smoke increases the chance of asthma cases amongst children. Diet also has a huge impact. I mean, they did say this in the Middle Ages in the Regimen Sanitatis, so it's nothing new that we know here, but we have more of an understanding of like sugars and fats, etc. With sugar and fat being the two biggest concerns, as sugar can cause type 2 diabetes, which is incurable, whilst too much fat can lead to the clogging of the arteries and heart disease. Drinking alcohol and drug taking. So alcoholism or binge drinking can lead to liver disease and kidney problems, whilst use of needles in drug taking can also spread disease. And there's many other illnesses that drug taking can cause. And sexually transmitted disease. Now, people are aware of how unprotected sex can cause disease and spread fatal, incurable diseases like HIV/AIDS. So lifestyle and cause of disease, we have more of an understanding on. The cause of disease and how we diagnose people today. Now, you've got to be careful. Diagnosis links with cause. Some people put these types of technology in treatment. It's not treatment, okay? The reason diagnosis is improved is because these two words here, science and technology. And the benefits of improved diagnosis is that the doctors can treat patients better using specific treatments, because this diagnosis allows for better focus on what is wrong with the patient. So you've got 8 types of diagnosis here. So you've got blood tests and biopsies. So blood tests can be seen, can track many things for conditions such as anemia. A biopsy is also where like a sample of human tissue can be used to identify disease. So for example, if people think you've got lung cancer, they'll take a bronchoscopy of tissue of your lung and they will send it off for a biopsy. Blood sugar monitoring allows those with diabetes to check their blood sugar levels to keep on top of their condition. So you can actually just make a little a needle prick in your finger, and you can track your blood sugar monitoring throughout the day if you are a sufferer of diabetes. CT scans are advanced X-rays which diagnose tumours and other growths such as cancer. MRI scans use magnets and radio waves, and doctors create an internal image of the body. Usually if someone's been in things like a car accident or something like that, they'll have an MRI straight away. This can be used to diagnose soft tissue or ligament damage. ECGs, which is an echocardiogram, uses electric impulses to track heart activities. If you go to hospital or A&E, they'll probably give you an ECG just to check your heart straight away. And they're very useful to help tracking patients who have had a heart attack. Ultrasounds are also known as sonograms, and they're used to build a picture up of the inside of the body. Usually, the ultrasounds are usually commonly used in pregnancy, but they can also be used to diagnose kidney or gallstones. X-rays from the 1890s were used to help see inside the human body without cutting into it. X-rays are more commonly used to diagnose broken bones. And endoscopes were small, thin, flexible cameras where you can see inside the human body. This is where you can see digestive problems. And they can also take biopsies of human tissue in the case of lung cancer, where you can have a bronchoscope. So that is lifestyle cause of disease, and cause of disease with diagnosis and lifestyle. Point number 3, we're going to be looking at treatment, magic bullets and penicillin. So this is probably one of the more tricky parts of the course because of understanding the different names and what they did. So antibiotics in the Middle Ages. In the late 19th century, so we're looking at end of the 1800s, more microbes for specific diseases were being discovered because of Robert Koch proving the germ theory, meaning that vaccines could be made. However, the hunt was on to make artificial or chemical antibodies that would attack the infection. So we've got 2 different types of magic bullet. We've got chemical that are made from chemicals and bacterial, which are made from bacteria. So the first ever magic bullet was Salvarsan 606. And this was where a man called Paul Ehrlich, who worked with Robert Koch, said that if certain dyes could stain bacteria, perhaps chemicals could kill them. Ehrlich said this would be like a magic bullet. It would shoot the infection, not the patient. So he set up a private laboratory and a team of scientists. And by 1914, they discovered several magic bullet compounds that would target and kill specific diseases. Now, the problem with, unfortunately, is that Paul Ehrlich managed to find a magic bullet that killed syphilis, but it also damaged the patient. Later on, a Japanese scientist known as Hatta found the chemical compound mixture that was known as Salvarsan 606 because it was the 606th attempt of mixing arsenic. And it could now be used to treat the sexually transmitted disease syphilis. And it was the first treatment of disease using chemicals. Okay? It was a major step in the progress of medicine. It was the first chemical that could be used to kill infection inside the body. So because this was proven, people wanted to find more. The problem with Salvarsan 606 is, though, it was made from arsenic, and arsenic is also a type of poison. So even though there was some negatives to Salvarsan 606, it got the ball rolling in regards to chemical antibiotics. The second magic bullet is known as Prontosil. And in 1936, Gerhard Domack found the second magic bullet after years of research. It was a red dye called Prontosil, and it killed the bacteria causing blood poisoning, septicemia. He first trialed it on mice, which proved to be a success, but he had the chance to then trial it on a human. And the first human he trialed it on was his daughter, who had blood poisoning, which could not be cured. He injected her with Prontosil, and she recovered. After further development and further understanding, doctors discovered that sulfonamide was the key ingredient which attacked disease, and were able to then create new drugs which cured things like gonorrhea, pneumonia, and scarlet fever. And it helped mothers dying from postnatal infections. What that means is infection after giving birth, from 20% to 5%. It was a huge impact. So there are 2 chemical antibiotics. The most impactful bacterial antibiotic is this one here, penicillin. It was the first antibiotic made using germs, bacteria, and not chemical. And it was made by 3 individuals. The first individual was Alexander Fleming. The second 2 individuals were Florey and Chain. And Alexander Fleming accidentally discovered penicillin after leaving Petri dishes with bacteria on them and noticed that a mold grew on it that killed a bacteria known as Staphylococcus. Fleming then tried to dilute the penicillin and found that it could kill bacteria, but only on the outside of the body, but not the inside of the body. So effectively, Fleming wrote his ideas down, but he gave up. He realized that penicillin had a potential, but he couldn't work out the potential that it could have on killing bacteria inside the body. So this is where in 1938, two Oxford scientists, Florey and Chain, managed to create pure penicillin, which could kill bacteria inside the body like septicemia. And the way they did this was they diluted it, they tried it on mice, and then the big task came to mass produce penicillin. And this is where the US government had to step in, because the British government, obviously this was during wartime, the British government didn't want to fund it. I mean, Florey and Chain could produce a lot, but they couldn't produce enough. So the US government funded and mass-produced penicillin so it could be used by the army during World War II. And they helped mass-produce 2.3 million doses. The NHS made it free for all, and it became a wonder drug to treat and prevent illness. So penicillin can be used actually to prevent symptoms from happening, but it can also be used to deal with bacterial infections. So penicillin has become one of the most widely used bacterial drugs that are used in the world. So what impact are there of antibiotics overall? Okay, now, obviously that graph in itself shows the impact that antibiotics have had. For the first time in history, doctors could now treat bacteria-based diseases. So if you have pneumonia, you can have antibiotics. And deaths by disease significantly dropped from the 1940s onward. So looking at this chart, this is actually a chart on childbirth deaths from infection, and it dropped significantly over time. Now, the work on antibiotics didn't stop. Using other fungi, to create more antibiotics. So there were more antibiotics created following the development of penicillin. So you had streptomycin, which was discovered in 1943, which was an antibiotic so powerful, it cured tuberculosis, which was previously seen as incurable. In the shorter term, antibiotics have been a miracle cure for disease, but however, they have got some negatives. In the long term, there have been some super resistant antibiotics known as MRSA, superbugs, who've become resistant to antibiotics, which proves a problem for scientists. And also things like septicemia, blood poisoning, are fighting off the older antibiotics. So antibiotics need to be continually updated to make sure they are becoming worthwhile for the patient and they don't become redundant and ineffective. So that's what you need to know on Magic Bullet's development of penicillin and also the chemical antibiotics, Salvarsan 606 and Prontosil. The next thing we need to understand is how the NHS helped change treatment forever, and how the NHS basically was a big step forward for the whole population of the country. So there's quite a bit of information here, so we're going to go through it. I'm going to annotate some things as we go. So care in the modern age. So the major problem in 1900 was the cost of medical treatment. The 1911 National Insurance Act did provide help for workers who felt ill, but it's a long way from including all the population like elderly, families, or unemployed. From 1912, clinics and schools did begin to give children free medical care. However, the big turning point was in 1948. The government set up the National Health Service. Now, following World War II, the government actually set up sort of this welfare state. And one of the biggest jobs of that welfare state was to come up with an improvement of the treatment aspect of the whole population. And it actually came from the 1942 Beveridge Report that said treatment should be available to the rich and the poor. And this document here, talks about, Parliament run the National Health Service. The NHS also controlled medical training and research, like teaching at hospitals and medical research. And the service is available to everyone at the point of delivery for free. Hospitals, specialists, blood transfusions, dentists, medicines and appliances, family doctors, ambulances, vaccines, health centres, health visiting, home nursing, and aftercare of sick, and maternity and child welfare. The NHS provides medical care for all of the population paid for by British taxes. All right? It's free, regardless of people's background. And the NHS is now responsible for over 2,500 hospitals and GP surgeries in the UK. There are still private hospitals which people pay for, but remember, the NHS provides that security of free treatment at the point of access. Now, there were some early problems with the NHS which had to be dealt with by the 1960s. So hospitals throughout the country needed desperately updating, and most of them were in the south, not the north. When the NHS was introduced, Britain didn't have much money to pay for it because of World War II. GP surgeries needed modernising, and GPs themselves were very suspicious of the NHS. A lot of them weren't interested in medical research and wanted to stick to their own way of thinking. And there were large appointment waiting times and delays. Okay, so by the 1960s, the government had to think about how to change this, and they did by the 1960s by building more hospitals around Britain. Even specialists like the Alderhay Children's Hospital were built. The Quality Care Commission was set up to monitor hospital quality. So they're a bit like Ofsted in school. So they would go to hospitals and give them ratings on sort of how they're getting on. The GP Charter of 1966 gave incentives to GPs who kept up with medical research and encouraged GPs to work in practices together. So they would probably give them financial incentives to keep up with the most modern ideas. And GPs were told to work together. So if you nip to the local GP, local medical centre, there'll be 6 or 7 GPs working together, and they'll be known as partners of that GP surgery. Okay. So what's the impact of the NHS? Yes, there's some negatives with it, and there's some problems, which we'll talk about in a minute. But the NHS was the biggest ever intervention by the government to improve the British public's sort of health, medical care and treatment. Anyone, regardless of social background, could receive the same level of service. Prevention. The NHS encourages healthy living. They administer vaccines, and they use checkups and modern technology to help prevent or catch diseases like cancer early. The NHS offer high-tech medical treatment and care, which we'll look at a bit later, but specialist doctors and nurses treat patients, and patients can now access a range of treatments such as lung transplants, chemotherapy, etc. Due to the impact of the NHS, life expectancy has also gone up significantly. But in 2015, the life expectancy of people in this country was 83, which is a lot higher than what it's been previously. And the NHS also provide training. Nurses have developed specialist skills. We also, some can now prescribe medicine, training for future doctors, for future surgeons around the NHS, and the government provides significant grants for people to get involved in this. Problems? Yes, there are still there. Waiting times and appointment delays. An aging and growing population may be putting a strain on the system. Increasing lifestyle problems which cause disease, so drinking, smoking, and drugs. There's a lot of this argument of the A&E departments in the NHS being full on a Saturday night with people who have drunk too much, which is putting strain on the NHS, and rising costs. There are lots of cuts going on, but the NHS costs are rising more than ever before. Remember, they are offering this for free. Okay, it's a bit like if someone were to work for free. Eventually, they wouldn't be able to because they have to pay for things. The NHS still got to pay for things, but the main money that it's coming from is the government. So there is still problems in regards to funding cuts and everything along those lines for the National Health Service. In sort of similarity to the National Health Service, we also look at treatment and surgery. So the next bit is going to look at how surgeries develop to help treat the patient. So treatment in the Middle Ages. We're going to talk about in the modern age, sorry. Don't want to be going back to the Middle Ages all of a sudden. So continuity from the industrial period. Even in the early 1900s, people still did take herbal remedies, treatments that were passed down through their families, and medical books made for home use. However, as time went on, companies such as Boots and Beecham's started to sell medicines which then could be used. So how did medicines and drug treatment change? We talked about this previously in the antibiotics bit, but cure-all medicines were now replaced by things such as aspirin, which we use as a painkiller and remedy for fevers. Magic bullets and penicillin were also developed. Custom drugs can also target specific health problems due to genetic conditions such as Huntington's disease. Pills can be now mass-produced in capsules which dissolve in the stomach quicker, whilst the development of things like hypodermic needles can allow patients to have quicker injections into the bloodstream, and insulin pumps help those with diabetes. Now, the surgical treatment and modern treatments is really important. We need to understand that the development in surgical treatment is absolutely significant. So we've got a few here that we need to talk about. In the 1900s, there were three major problems for surgery. You had pain, infection, and blood loss. They've been solved because of Lister and Simpson. So the use of new modern science and technology allowed medicine to treat illness, injury, and any medical condition. So we're going to go through a few of these. So we've got keyhole surgery. Keyhole surgery, which is known as laparoscopic, uses tiny cameras and minute instruments to operate. It means quicker healing and less impact on the human body. Microsurgery is where tiny nerve endings and blood vessels can be reattached after surgery, which helps transplants develop, with the first kidney transplant successfully being done in 1956 and the first heart transplant being done successfully in 1967. Robotic surgery can also be used because surgeons can now use computers to control instruments for precision surgery. And this can sometimes be used in brain surgery. And also anesthetics. So anesthetics have changed significantly. From the 1930s, anesthetics started to be injected into the bloodstream, which allows precise doses and safer surgery because the patient has less chance of waking up during that procedure. The treatments have also developed. So we've also got modern day treatments such as X-rays. So X-rays can now be used to shrink tumors inside the body, which is called radiotherapy. Blood transfusions developed after the 1900s. Scientists can store blood for transfusions due to solving problem of blood clotting during World War I by adding sodium nitrate. We also in 1901, which I'll add on this page here, in 1901, a man called Landsteiner, Karl Landsteiner, found blood groups. And he found we had 4 blood groups, A, B, O, and AB. And O was a universal blood group. Okay, this helps more because you are making sure you have the correct blood if you need a blood transfusion to prevent your body from rejecting the blood. We also have more modern machinery like dialysis machines, which keep kidney patients alive until a transplant is available by sort of washing their blood out, and they need that sort of weekly. Heart bypass machines also help with pacemakers as well, performing the function of a heart while people are waiting for heart transplants. Genetic therapy is another form of treatment which takes normal genes from a healthy donor and puts them into the DNA of someone that's suffering from a genetic disease such as cystic fibrosis. So they're trying to basically replace the poor cells, the poor genetic makeup with positive ones. And also stem cells are being used to try and reverse blindness, but that's in the very early stages. And then also we've got robotics for treatment. So prosthetic limbs are now being used to help amputees, especially those who've been injured in Iraq or Afghanistan in the early 2000s. And another big change we've got going on is we've actually got 3D printing. The hope is in the future for 3D printing to be used to print things like hearts, kidneys, etc., so that they can be put into a patient without having to wait for a match of an organ donor. How much change was there in treatment? Yeah, a lot. Okay, medical treatment was a significant change. Deaths from infectious disease went from 25% to 1%, and life expectancy, as I mentioned, has gone up to 83. However, there are new diseases constantly appearing without immediate cures and treatments. And with the rise of drug-resistant bacteria, there's a growing concern for the medical profession. People still rely on alternative remedies like herbal medicines and homeopathy, like acupuncture. And there are currently no cures for things like cancer or heart disease, which are also linked to lifestyle factors. So even though there is a lot of positives, there's still a lot of work to be done within medicine for a universal sort of change. There's two more topics to go through in this, and this is going to be prevention of illness and lung cancer. So with prevention of illness, we've got the information here. And again, I'm going to go through it and add a few annotations. So the government's taken significant steps in terms of improving public health, all right, since 1900. And that's because we know what causes disease more, all right? And we also have an understanding of the methods of prevention. Now, once the cause of disease and health problems are understood, the government can introduce more methods for prevention. So compulsory vaccinations, vaccine campaigns launched for measles, polio, and diphtheria. Screening for genetic diseases, so Down syndrome during pregnancy, or testing genes for breast cancer. Communicating health risks. So during times of global epidemics, so for example, Ebola, 2014-15, government tracked travelers and put quarantine measures in place, and by discussing with the other countries that suffered with this to try and prevent mass spread of epidemics. And also charity. So British Heart Foundation creates adverts encouraging people to protect their heart by giving up smoking, eating less fat, and exercising. But what else did the government do? If you were to get a question saying explain why there was progress in prevention of illness in the modern period, you've got your 3 paragraphs here. So vaccine campaigns. The first vaccination campaign against diphtheria was launched in 1942. Over 3,000 children died a year from diphtheria. So in World War II, the government took total control. Children were now immunized and diphtheria died out. Other significant vaccination campaigns included those against contagious disease, such as polio. The first vaccination was introduced in 1956, and there hasn't been a case of polio since 1984. You've also got other key vaccinations that have been introduced, such as tetanus in 1961, measles in 1968, and rubella in 1970, which is very dangerous for unborn children. And the government have also introduced vaccines, which some of you would have had at school, such as the HPV vaccination, which prevents women against an STD that causes cervical cancer. But the main concern for government is that parents are free to decline having their child vaccinated, causing potential illness. Another problem is that some vaccinations, like the flu vaccine, have to be changed every year because what happens is the germ changes and makes vaccination sometimes less effective. You can obviously tell with the modern day today that the government have had a big part to play in making sure that the vaccination campaign for COVID happens. Okay, with 20 million people being vaccinated within about 8-9 weeks of it first becoming a thing. The government also passed laws to help people with prevention of illness, so to provide a healthy environment. So the Clean Air Act of 56 and 68, it was passed to prevent bad smog in London caused by burning coal. It was basically a law to prevent air pollution. You've also got the smoking ban inside all the public buildings on the 1st of July 2007, and laws being passed to limit car emission. So higher taxes for cars that cause more pollution to encourage people to get rid of that car and replace it maybe with a hybrid car or something that is electric. You've also got the government lifestyle campaigns. So the government have campaigns to help prevent diseases like cancer, heart disease, HIV and AIDS by promoting healthier lifestyles. So we've got things like advertising campaigns, which warns about the dangers of smoking, binge drinking, drug use, and unprotected sex. Stoptober, which tries to encourage smokers not to smoke for an entire month to get them to maybe consider quitting smoking in the long run. Sugar Smart and 5 a day to encourage families to eat well and move on. And move more, so exercise. But obviously this Sugar Smart app allows parents to see how much sugar their child should be having, which will prevent things like dentistry problems, diabetes, weight gain, etc. Everyone also over the age of 40 is given the opportunity to have a health check every 5 years, which focuses on blood pressure, weight, cholesterol levels, and it also includes lifestyle advice. We do also have screening for certain cancers, which are really important. Obviously, developing, like, you've got to have screening for cancer such as colon cancer, which I believe is 50, that you can have free screening to make sure that you are staying healthy and preventing early stage cancer from developing into later stages of cancer. Last topic that we've done in lockdown is lung cancer, cause, treatment, and prevention. So this is a depth study, and you can link this into any question you get on the course, on the modern part of the course. So lung cancer became more common since 1900, 40,000 new cases a year. It's become the second most common cancer and leading cancer amongst women today. The rise of lung cancer deaths has also risen, peaked at 26,000 in 1973. Now, the big turning point was in 1950 when the British Medical Research Council proved that lung cancer was directly linked to smoking. 85% of those that get cancer are people who do or have smoked. It is particularly deadly. Only 1/3 of people with lung cancer live a year after their diagnosis, but there is ways of improving this. And originally, X-rays were used to identify tumours, but this was very inaccurate. And the way in which we diagnose lung cancer is through stages. So patients are given a CT scan, often after being injected with a dye to create a more detailed picture. If you do then have cancer, doctors do one of two things. So you either have a PET CT, which uses radioactive material to identify specific cancerous cells, or you have a bronchoscope, which is basically like an endoscope, but it takes a sample from the lungs to be sent off for a biopsy. This then allows the doctor to come up with a treatment plan, however advanced it is, and what treatment is best for the patient. So we've got some treatments of lung cancer here. So we've got surgery. So the earliest method, which is developed with microsurgery, lungs can be transplanted, but it does leave ethical questions. For example, does someone deserve to have a new lung if they've chosen to destroy their own? Again, that's an ethical debate that's probably a totally different subject. Radiotherapy aims to kill the cancer cells using beams of radiation to target the cancer precisely. You've got chemotherapy, which has been used since the 1970s, and is surgery and radiotherapy, if surgery, hasn't been successful. And it's where chemical medicines are used to shrink tumors or prevent cancer returning, but it can have very serious side effects, constant nausea, sickness, the hair loss, negative side effect, which I'm sure people would be aware of. You've also got immunotherapy. Now, cancer can resist the body's immune system's attempts to fight it. So scientists are currently researching a way to boost the patient's immune system to fight cancer. However, as of 2016, there is no cure for cancer, which remains a big focus for medical researchers on a daily basis. The prevention of lung cancer, very simple. Okay, the government have had a big part to play in this. So the prevention of lung cancer, the government was slow to intervene until lung cancer deaths grew too high and smoking-related deaths cost the NHS 165 million yearly. The government passed laws to force people to change their smoking behaviour. So in 2007, smoking in public places was banned. It was extended to cars in 2015. There was evidence that passive smoking had a negative impact on health. Taxes on tobacco were increased, and you must be 18 to buy cigarettes, which cannot be on display. The government also found ways to influence people's behaviour. So, for example, advertisement was banned entirely from 2005, and packing now contains warnings. And the NHS produced campaigns to advertise the dangers of smoking, including education within schools to stop young people from smoking at all. So the last thing we need to look at is two things. How much progress was there in the modern period, and what factors pushed progress in the modern period? So we have got a lot of progress in this time period on the different factors. So cause, treatment, prevention, and care. But there are still things to continue more to do. So cause of disease. We can use DNA to identify genetic diseases such as Down syndrome. The Human Genome Project allows doctors to use DNA to identify hereditary diseases like cancer. Influence of lifestyle factors are linked to disease, such as link between smoking and lung cancer from 1950s. and modern technology can accurately pinpoint illness, so like blood tests, CT scans, endoscopes. However, even though there's huge changes in the facts we can identify the majority of diseases, we can't always cure or treat genetic illnesses such as Huntington's disease. So that's definitely more to do. Treatment, been huge advances. Okay, surgery, they've solved the three key issues: pain, blood, and loss and infection. Surgery's become a lot more advanced, so robotic surgery, microsurgery, keyhole surgery. Antibiotics, so development of Salvarsan 606, Prontosil, and penicillin allows us to treat more effective illnesses like pneumonia, and it's made free on the NHS. And we've also got other sort of treatment, such as machinery, such as dialysis, transplants, blood transfusions, and even paracetamol. Problems: the rise of the superbugs like MRSA and the evolution of septicemia proves that problems for doctors as they are resistant to modern day antibiotics. And doctors cannot treat some of the major diseases like lung cancer or genetic disease like Down syndrome, which are currently incurable. Prevention and public health, the government have had these vaccination campaigns which have ended the threats of things like polio. We've got the lifestyle campaigns which has been set up like 5 a Day and Stoptober. The Clean Air Act, car emission taxes and smoking bans have sought to legally improve public health, and identifying hereditary conditions early to have the preemptive surgery to reduce risks. But there is a struggle by the government to encourage people to live better lives. Okay, more people still refuse to immunize their children due to the fear of vaccines, which increase the risk. Then we've got care. Setting up of the NHS being one of the biggest improvements in British medical history. Also, regardless of social background, you can receive the same level of care which is paid for by taxes, which means that we've got the high-tech medical treatment, which we talked about in the treatment section. We've also got more quality training for nurses, GPs, and the latest medical research, such as transplants, always being fully updated. Big problem: the NHS, modern period, having the rising costs, reducing in funding, and also the increasing aging population putting pressure on the NHS. To conclude with this, the modern period has had the most significant change over time. Okay, there are constant challenges, there are constant evolving conditions, which means that, but it shows that medicine has made a rapid and lasting progress by the end of this course. I'm just going to leave this bit up for you because obviously why was there change in the modern period? You can break it down into factors of science and technology, work of individuals, the government and attitudes. So you can read over this at your own sort of pace, but that is everything you need to know on modern medicine. And that's everything we've done during lockdown in a very short, I think about 35, 40-minute video. Thanks very much.